Hello and good afternoon. Unfortunately, I have to stop your conversations now to welcome you to the 28th Annual Kovner-Behrman event and our first one in our new home here on 17th Street. How many people are in the building for the first time? Welcome back to Wagner. I am Professor Carla Sampson. I am the academic director for the health programs here at Wagner. Must know we have our health policy and management programs and specializations and our online MHA program and our newest program, my joint program with the law school, a Master of Science in Health Law and Strategy. Tonight, my job is very easy because all I need to do is get out of the way of the main event. And I'm going to do that right now by handing you over to our Dean Sherry Glied, who will moderate our illustrious panel on our topic about uncertainty and all the fun things happening in healthcare tonight. So take it away.
Great. Thank you very much, Carla. Good evening. I'm Sherry Glied. I'm Dean of NYU Wagner, and I want to welcome everyone to the Kovner-Behrman Health Forum. We're here tonight because of Emeritus Professor Tony Kovner, who unfortunately is not able to join us tonight. He created this forum 28 years ago in honor of his mother, Natalie Lieberman, who made the series possible with a very generous financial gift in honor of her son and of her parents, Dr. Percy Behrman and Mrs. Ava Behrman. Many of you in attendance have also given donations to help fund this program, this series over the years, and we're very grateful. We always choose a very timely topic for Kovner-Behrman, and this year was actually hard to choose a topic because things are changing so fast, we couldn't figure out what the topic ought to be. And after much struggle around that question, should we talk about Medicaid or private health insurance or private equity or whatever, we finally decided that actually the topic that was of most interest was uncertainty. And what do you do when the world is shaking all around you and you are facing a set of challenges that you don't even fully understand? So once we had settled on that, it was not that hard to pick a panel. We wanted to pick a panel of people who had dealt with a lot of uncertainty in their careers and had triumphed over it. And I'm really delighted to have these three wonderful people with us tonight. Let me start just to my left here is Pam Brier. Pam's career in public service and hospital administration spans 4 decades, 5 mayors, dozens of successes. She served at Health and Hospitals and ran Jacobi and Bellevue Medical Centers, followed by 20 years overseeing Maimonides Medical Center. So she's been through many crises of medical centers over time. Next to her is Jeanne Lambrew, my former colleague in the Obama administration and actually in the Clinton administration back then, now Director of Healthcare Reform and a Senior Fellow at the Century Foundation. From 2019 to 2024, that time spans COVID, you will remember. She served as Commissioner of the Maine Department of Health and Human Services. She was also a senior official in the Obama administration. She helped to design the Obama healthcare plan. She's held several policy and academic positions as well. And finally, Pat is the president and CEO of Healthfirst, one of the largest nonprofit health insurers in the country, serving 1.7 million or more fully insured people in downstate New York, including a third of New York City's Medicaid population and a lot of Medicare Advantage beneficiaries. And she served on several advisory committees, including now on one with me, for which I'm very grateful throughout her career. So I think we're going to have a lot to hear from. We'll have a conversation amongst us, followed by Q&A and a reception. So let's get started. I've asked each of them to tell me a little bit about a situation that they faced where there was extreme uncertainty about what was coming next and how they addressed it as a leader. So let me start with Pat at the end there.
Sure. Good evening, everybody. It's great to see you. And yes, we are now.
Can you all hear? Do you need more sound? All right.
Can you hear me okay? Okay. Thank you for the question, Sherry. And my responses will be based on my leadership of Healthfirst, not-for-profit regional plan, 2.1 million now and growing. So we're really very proud of the plan. I'm going to choose, in response to Sherry's question, a somewhat interesting example, since I am sitting tonight with two of the brilliant architects of the Affordable Care Act, which expanded healthcare coverage to tens of millions of people around the country and was phenomenal. But It was a major change and restructuring of healthcare and how it was delivered and how people obtained their healthcare coverage. We are a regional not-for-profit Medicaid plan, and back then, end of 2013, we had about, I don't know, 950,000 members. One of the things that the ACA did by expanding Medicaid and creating the exchanges was to send a message to health insurance companies everywhere that the government programs are now a big source of growth. And so whereas Medicaid had been sort of the almost exclusive province of smaller regional not-for-profit HMOs like Healthfirst in our downstate New York market, all of a sudden it was big business. And so kind of looking at that situation, and in fact, over the course of the years prior to 2014 and subsequent to 2014, we shifted from 80% of Medicaid consumers being in plans like mine to just the reverse in terms of the proportions in national publicly traded commercial health plans. So while they were busy trying to figure out their strategies to, I would say, reach down into this individual market, we were thinking of strategies of how are we going to survive? Capital constraints, scale is vitally important for a health insurance company. We had scale, but we were very, very much confronted with a situation of how are we going to compete now with national plans that are suddenly interested in this business of serving very low income people in our communities. There were also major changes to the Medicare Advantage program that we had never encountered before. So as a relatively smaller plan, we really had to figure out how we were going to compete. And just some of the responses I think that we developed, I think for the first time, it really caused us to focus on strategy, and in particular, what our unique strategic strengths were. It wasn't capital, it wasn't scale, it wasn't multi-state presence, it wasn't huge investments in technology or IT, but what we actually developed is our first unique identification of our unique strategic advantage. It was trust, because we were and are a homegrown plan. It's a value-based payment model, so we have very close relationships with the provider community. And when we went through the exercise of realizing that, we started focusing on that and building on that and investing human and other capital in building that trust, and it became a watchword of the company that continues today.
Thank you. Jeanne, over to you.
Thank you again for doing this great topic. And I could give you a lot of examples, sadly, in my career for uncertainty, but I will, and I partly because I was there in 1994 when there was a Medicaid block grant debate that some people are now getting some echoes of. Certainly, the Affordable Care Act has its own history here, and we'll talk a little bit about that. But I really will talk about COVID-19 and my experience leading Maine during that period. When the pandemic hit, Maine was identified as the most vulnerable state for two reasons. First, we had the highest percentage of older residents in the nation. And second, our economy is small business, agriculture, tourism, all of those things that with government shutdowns were going to get hammered. So we were expected to do poorly. At the end, though, we had the highest vaccination rate for our older residents. We are in the top 5, 10 of every statistic on COVID-19, and our economy has continued to grow and outpacing all of other New England economies in the post-pandemic period. So I would just say, and you asked for some high-level lessons, there are 3 that I would just say. Number 1 is we were prepared. It's hard to say you could be prepared for COVID when we look back at the beginning of COVID, but anybody who's been around for a while knows that there was the Spanish flu. For me, there was H1N1 when I first arrived at the White House under the Obama administration. There was Ebola. How do we deal with the uncertainties of Ebola? And knowing that that was a known unknown, I spent the first year of my job building a team and recruiting excellent people. So public health is one of those areas where we actually have a prototype. Public health directors have training, they have experience, they have association. I did a nationwide search, found somebody who was told to resign by the two senators from Illinois. We were talking about Illinois earlier, um, because of his problems, but any public health official will have some of that in their background. Dug in, hired this person. He was phenomenal. His name is Nirav Shah. He became deputy director of US CDC in this last stint. But I was prepared because he was there. And as a note, December 2018, he was saying, or just 2019, he said, let's start preparing for something that I'm worried about. 3 months ahead of everybody else. The second was organization. When it hit, we were very clear about our organization. We had concentric circles. There was science. Nirav Shah led the science team at CDC to really make sure we were understanding what was happening, where, and how. And then there's a primary healthcare response. That was our hospitals, our providers, our nursing homes. How do we make sure people responding to COVID are prepared, trained, and supported? Then there are all those secondary effects. We had a team working on mental health. How do we deal with the economic effects of the pandemic? And it kept going with the governor being clearly the leader of the effort. Back in 2020, Trump was in the White House, right? Didn't have a lot of leadership from there. So our governor was leading our effort, and I helped manage interagency processes, learning from my government experience in the past how to do that. And just lastly, I'll say, we just stared at the problems. We knew that the hardest and worst days, it didn't mean you go hide and look away. We had to look at it, understand it, figure out a way to try to problem solve, and recognize we weren't always going to be able to do so. That's not easy, to admit that you're not going to fully succeed, that you will fail often, and there'll be problems. But we were very rigid about root cause analysis, understanding it, communicating about it, and engaging with people. I think most people in Maine look back on the experience still and say thank you for it, which I think is unusual in the public health venue. But I think that's partly because of a team able to manage through crisis and uncertainty.
All right. So let me get the mic right up at your mouth.
Like this. Hello. Okay. How many of you in the audience, I'm just curious, have worked before you came to graduate school? Oh, great. Good for you. Then you already know how hard it is to work in an organization and have it run well and feel good about your colleagues and feel organized and looked out for and challenged, right? Some do, some don't. It's very hard to be a leader. It's very hard to be a follower of a bad leader. And I've been thinking about experiences I've had. I've almost always worked in hospitals that served mostly poor people. And if you do that, you are always worried about money, always, always. It never leaves you. And you wake up in the middle of the night wondering how you're going to get the resources to take care of people who you want to take care of. But I guess I would say there's so many things to say, but just looking back at my own experience, common sense and a sense of humor gets you very far in life, day to day. Having a sense of your own set of fundamental principles and values, I would say, is fundamental. And knowing what you're talking about is essential. So those three things together, I think, really make for successful leaders and successful staff people who work in an organization and want to feel good about going to work in the morning. So I could think of so many of my failures, but I won't tell you all of them tonight. When I began to run Bellevue, which was in the early 1990s, the city was recovering from a fiscal crisis, and Bellevue had more patients with active TB and with AIDS than any other hospital almost in the country. And we had no money. The budget had been cut a lot, and I was the 10th person in 10 years to come along as the executive director. And believe me, people were not happy to see me. They had thought if they were very quiet and said nothing, that I would go away, but I didn't go away for a while. So what do you do about that in the first place? And in the second place, people were terrified that they were going to get either AIDS or TB. And who can blame them? the air quality in the building wasn't good, and there were windows that never opened, and we had no money to buy protective gear. And I went home at night thinking, what have I done? How did I get here? So what do you do in a situation like that with a group of people you're just getting to know, and a lot of horrible problems facing you? Well, the first thing you do is to make sure to eat and exercise well and get a good night's sleep, because it does help you get the wherewithal to deal with these problems. But more seriously, the only thing that I could think of to do was to get the staff together. And that means not just senior managers, but people on the units who were taking care of patients, who knew what we needed in terms of protective gear and rooms that were safe and didn't send TB air out into the rest of the hospital. People on the front lines who knew perfectly well what the issues were of taking care of patients. They may have worn uniforms and had low income service jobs, but they knew plenty. So I had them on hand, as well as doctors and other professional staff. And we made a list of all the things we needed. We needed, as I said, protective gear. We needed negative pressure rooms. We needed a way to get the air quality to be a little better. We needed a whole bunch of things that we really couldn't afford. And we ranked them in sort of order of priority. And then everyone had an assignment about what they had to do. And we looked around for money. There wasn't much money. We took on new assignments at Bellevue because we knew they would come with money that the city would give us. We had negative pressure rooms when the Board of Health sequestered people who didn't take their TB meds. And really, by building a team of people who were organized and felt positive about looking to their colleagues and their coworkers to help them solve problems, we created a team, a really big team, and we managed to get ourselves out of and get ourselves out of trouble and get most of the things we needed. I will say that at the time this was all going on, there was a horrible article in the New York Times that said that people with AIDS were afraid to go to hospitals because they were afraid they'd get TB. And of course, they were describing Bellevue. So I hope this tiny vignette gives you some idea of the kinds of things that you have to reach for when you encounter a crisis that seems so big, it's overwhelming, and you are the person responsible. It's daunting, but it's doable.
Thank you. All right, so all of you, I think, spoke about how you worked with staff to try and get through a crisis, I think. And I think one of the things that's interesting as you talk about working with staff is that there are only so many staff that you can touch yourself. There are the people you work with directly and you have to support them. And then there are the people who work for those people. Mm-hmm. How did you think about both getting the information from them, as you talked about, and getting the expertise, but also supporting them as they faced a concern about whether the place is all going to go under and they're going to lose their job, or they're going to get TB, or they're going to get COVID? How did you think about, how did you work with staff to deal with uncertainty? Anyone can start.
I'm glad to start.
All right, start.
It's a real challenge because the people who work directly for you hear your message, talk to you, influence what you have to say and what you think, and understand what you're doing and why you're doing it. The people who work for them kind of understand. I mean, hospitals have lots of hierarchies, but the people, the middle managers, the unit managers, they don't always hear firsthand, and they don't always have sort of the breadth of knowledge because they don't see everything that you see when you're in higher levels in organizations or talk to as many people outside the hospital. And when it comes to the people who are mopping floors and cleaning the hospital and serving meals and handling patient accounts, and all these people who take care of patients at a very basic level, nurses to some extent, they are dependent on those middle managers to get information. And so what I'm trying to say is you must have a team. You must build a team. I mean, I used to talk about the 6,000 person team at Maimonides, where I was for a long time. And the other CEOs who I would meet with every month would sort of roll their eyes. You know, what is she talking about? Well, it's true, really. If you listen to an eminent surgeon at Harvard who did a classic work on medical errors in hospitals, his point of view is that the two things that make for an effective, high-quality hospital are teamwork and mutual respect. And those are things you might not think of. You might think it's clinical expertise, but if you don't help people understand that everybody has something to contribute and that everybody is worth talking with, and that there's no way you can take care of a patient all alone by yourself, just doesn't work. And you have to form teams and people to work with. Then you are hoping to get someplace. But make no mistake about it. I mean, it's a life's work, Sherry. You never are done doing these things, ever, as long as you have the job.
Pat, Jean, whoever wants, go ahead.
Okay. So as we have grown, we have developed different ways to communicate with we have 6,000 employees, but they're mostly in downstate New York, but they're located in other parts of the country too. So we have, I think communication is a really important thing. So our intranet is pretty elaborate at this point, I think, in giving lots of information about everything going on in the company. We have sort of virtual town halls. They're called Chats with Pat, where, you know, thousands of people can be on a phone line at the same time and have an open forum to talk. So I think communication is really important. I think as a leader, one of the very important things in times of uncertainty is to recognize that everybody is watching you. Everybody is who can physically see you on a Zoom screen, what have you, and that you have to be careful about sort of expressing your frustration or your own worries, et cetera. Because what your employees really want to know is, am I going to keep my job? Is my leadership on top of things? You know, are they active? And so communicating to them the things that we are doing proactively is very important. The team, as Pam described it, is critically important. And I think that reminding your gigantic team of the mission of the company at Healthfirst, it's a pretty mission-oriented group of people. You know, the members are North Star. That's a very important phrase to the members. So just reminding them that what they do matters, even in a time of uncertainty, is important. Empathy for the employees is critically important. During COVID, we set up a number of really meaningful Zoom-enabled meetings that started with they were facilitated by our own medical and behavioral health staff to allow people to just talk. And it was incredible because people were going through a lot, as you can imagine. It's like their personal circumstance, having to go home on a moment's notice, you know, working from crowded apartments with their families and their kids running around. Some of our employees were like, I'm cracking up. I'm going to go out of my mind. So providing as many resources as we could as a company, but also providing those forums was really quite important. It was very bonding. The final thing that I will say is, and this happens a lot when I talk to our extended leadership team, you know, you can talk about everything that's going on, what you know, what you don't know, at least to date, because we don't know what's going to happen, that's how I basically end it. We really don't know what's going to happen. We think that some things are going to happen, but we don't know yet. And at the end of the day, when you don't know what to do your jobs. And I actually think that that is a comforting thing or way of being. I say that to myself, okay? Because you can drive yourself crazy wondering what's going to happen and thinking about every terrible scenario. But at the end of the day, the job that you have is really quite important. So just do your job and remember to keep the members in the middle of your line of sight. If you can figure out and always follow what they need, we will always figure out kind of how to survive, because that is our purpose for being. And so I think aligning people that way and reminding them that what they do today is very important is helpful.
And I knew I should not go third because all the things I was going to say have already been said. But I'll say it slightly. I have a couple additions, I would say. So I think there's something fairly unique about people in this panel and everybody in this room. Is there something special about working in healthcare? The mission of healthcare is something that we spend a lot of time thinking about, talking about, trying to pull that common thread. There's an invisible thread that connects people to these jobs, which is compassion and caring about other people, trying to help them at their hard moments, and making sure that people understood the mission in the way that it mattered in the moment was something that I actually learned from President Obama during the dark days when we were not sure we could pass the Affordable Care Act, when we're not sure we could implement the website, when we're not sure the Supreme Court would uphold it. He always had us focus on, why are we doing this? Who is that person out there who needs this? And how do we go back to our desk, back to our jobs, back to wherever to try to work to make a difference? And I think go fast forward through the pandemic, that certainly mattered a ton. And obviously communication matters a lot. And I do think during crises, the leadership, people are looking for leaders in different ways. I did all staff notes almost every day during the worst parts of the pandemic. I was out there. I went to the office every day. We were remote. I went to the office every day because guess who doesn't get to work remote? The people who are cleaning the buildings or answering the phones or doing those direct service jobs. Our child welfare staff was working in person because they had to. So modeling behavior sometimes in small ways as well as large matters. And the last thing I would say is acknowledgement. There's nothing like saying thank you for small things and big things, for the things that are not exactly on point, but somebody during the pandemic making sure that we kept our website up, or making sure that we were continuing to focus on different aspects of our aging network, right? Saying thank you during those moments of crisis matters a ton.
Thank you. This is not a moment of crisis. At this instant, we're not in a moment of crisis. So all of you talked a little bit about keeping your eye on the mission, on where you're trying to go. But even speaking from my own experience in the very small crises that one has in a university, which are relative to the world, a little bit smaller, not these days, it's hard to keep a distant focus and a strategic focus when there's incoming all the time, when there's just a barrage of incoming. So how do you do that? How do you stay strategic or even turn, I'm remembering the dark days of the Supreme Court stuff. How do you turn a moment of tremendous uncertainty into a moment of strategy?
Jeanne, you want to go first
try?
this time? So I don't, all my points get taken. I actually think that you do have to, in leadership, acknowledge what might give, because sometimes you can't do it all. So you have to figure out, okay, these are our priorities, and what have been our priorities under a different set of circumstances are no longer they're paused. They're not gone. They're just paused, because sometimes that forgiveness to people of saying, like, look, we're going to focus on this. We appreciate that this was something you're working on. Employee engagement, for example, during the pandemic, we put a pause on that. We were not doing what we were doing to build a team during the pandemic. Saying it's okay to pause on things, we'll get back to it. It doesn't mean it's not important, but having leadership do it and not having people feel like they were tripping on their jobs, I think was important. As well as, just trying to delegate. I mean, a lot of what I did during the pandemic and all my jobs was say, okay, I'm going to go over and focus on this because I have to, but you, go, do it. I'm going to give you the guideposts. Here are the guideposts, but you go do your jobs. And that ability to let go and delegate in those moments, I think matters a lot.
Pat?
Um, so I like to really use as a touchstone some of the work that we did around strategy to, it started with what I described before, um, but we have evolved that to really understand how we want to show up in the market and what we think our unique competitive strengths are. And those pillars are very helpful guideposts, even when things are a little bit tumultuous. Right now, I would say that the watchword in the organization, because, programs may shrink, there may be fewer resources, and you have to do more with less, is to focus on the most important parts of our strategic plan, to have an active and dialogue and set of activities to identify the highest and best use of our resources versus what is valuable. Going through that exercise is important because organizations grow and they engage in lots of incredibly wonderful, important activities, but sort of backing up from it to always ask the question through the lens of our strategic goals: what are the highest and best use of our resources? Because we want to continue to invest in those things. And we need to move the organization forward. But in order to do that, you have to be strategic about that as well. So I think, it's also for my organization, the theme this year is like, if life gives you lemons, figure out how to make lemonade. And I think that that's sort of motivational to my teams, to be perfectly honest with you. People are trying to be creative. They're very, very proud of the company and what we do. And I think folks are really trying to be creative about how to use technology, how to use analytics, how to use plain old human warmth and contact to make everything that we do count a little bit more and have a little bit more impact, and understand, how and where we are the most impactful.
Well, I would say that there are strategies that people in organizations put forward and think about, and then there are more fundamental, and some of those strategies are things we should do this year or next year. And then there are more sort of fundamental goals of the organization that you're trying to put forward, and you come up with strategies to help you realize that goal and be the embodiment of that goal or those goals. And you don't give up on those. I would have said until maybe a month ago, you don't give up on those when the world comes to an end. That's before I really saw the world come to an end. But even now, you don't give up on those. Just if you set out to increase your volume in obstetrics because you're providing really great obstetrical care with low complications in an inexpensive way for poor people, which is what we did at Maimonides. And you want to increase that number because you're going to increase the viability of the hospital, and you're going to take good care of women who are having babies. And you start on that road and you all agree on a plan, and then budget cuts set in, or the federal government tells you it's slashing Medicaid. And by the way, it's going to slash obstetrics just as well as everything else. You don't give it up. You just don't give it up in the first instance. You keep in some way working toward that. You don't switch strategies just because times are bad. You have your fundamental core sort of values that infuse what it is you're trying to do strategically. The finance people, God bless them, and if some of you are in finance, this is not directed at you, or at Pat, who is luminous when it comes to finances and managing them, has been. But some of the finance people would say, oh, we have to cut everyone's budget. And I would say, well, that's probably true. We do. But let's not forget that we sat in this room and we developed what we all said was a core strategy. And we're not going to cut that budget just because we're having trouble right now. we're going to hold on to it as long as we can. And maybe someone else or someplace else will have to pick up some of the slack from that. But if you're really going to build an organization over the long haul, and all of us are going to live through the next 2 to 4 years, I'm confident, then we want to keep our eye on saving and looking out for what continues to be important, no matter how bad times get. I don't mean to sound like a Pollyanna. I mean, in fact, I think it's a hard lesson to teach people that you don't just abandon everything and save money across the board on everything because the world looks bad. I think it's really important.
So let me follow up on that, because actually that raises sort of the opposite question, which is you do have to give up on something, right?
Yes,
You
we do.
can't do everything. How do you
Correct.
do that? How do you give up on things that until now, this seemed like the important thing to do, but
Yeah.
but you just can't do everything.
You're absolutely right. You cannot do everything, and you do have to give up on some things. And how do you figure that out? Well, that is a very good question. You can ask each other and probe each other. You can ask the doctors who take care of patients. They know a lot. But you know what? You can ask people in the community. You can ask patients, what is important to them? What do they think they need in their community that they can't do without? And that ought to give you a pretty good sense of some things that you would consider core values. You can't give up on making financial improvements and doing everything you can to become more financially viable in billing, collection, a whole bunch of things that don't necessarily have an impact on patients. But you have to ask, you really have to ask the right people what they think. And I don't think the answer can be found just internally. I think you really need to ask the people who are receiving the services.
Yeah, I can certainly talk about what we did during COVID, but I am gonna fast forward a little bit because I think the current debate is a good example of this. I quit my job in Maine last May, thinking if one person gets elected, I may need to do defense, and if another person gets elected, I might be able to do big health reform ideas because we have lost some of our big ideas. So that was what I was going to do. One of the things that I have been doing, especially in the last couple of months, is saying if everything is a priority, nothing is a priority. We have to think hard about if something changes, can it be rebuilt quickly? Are there alternatives out there that could provide the service or the need? Are there ways to reconstruct or to mitigate problems if they happen? And then vice versa. What are the things that if we lose it now, we'll never get it back, right? There's a filter and a set of questions that you could ask as you're doing this kind of harsh prioritization. And it really is, you want everything on that list to be done. You just have to rank order them though, because if you don't figure out what you care about most, you'll fight something small, you'll wear out, you'll all just be exhausted. And then the one of the 100 things that gets done that truly is harmful, you have not done your best to try to fight, which is what I'm doing a lot on Medicaid right now. How do we think through what matters the most in Medicaid? How do we protect that with what's going on in Congress, with the marketplace? I've been thinking a lot about the policy. Where again, how do we figure out how to triage and focus? Because it's a lot of noise if you try to go after everything and people just tune it out at some point and they give up.
Could I just
Sure, please.
I don't mean to cut you off, Pat. I just want to underscore that point. There are some things that we have learned, those of us who are old and have been in public health a long time, we have learned from the past. For example, we have learned that it takes more than medical care to make people healthy. We have learned that food is an important component of being healthy and is good public health, and a whole bunch of other. We have learned that you have to look at the body and the mind together if you're going to really take care of a patient with chronic schizophrenia. We have learned these things in decades of projects that have succeeded and failed, and we need to take those into account to some extent, because the ones that have persisted and lasted have done so for a reason, right? Because they have managed to augur, if you will, for the greater good of acting on these fundamental core principles, I think, of healthcare, and kept their eyes on things financial. So they have taken what makes health sense and fiscal sense and married them together. Something I will tell you that our state government, as one government, has not been so terribly able to do over the decades. But that's really part of the trick here, I think.
I think it's human nature, which is reflected in organizations and government, to always want to do more. It is really much easier to think of new things to do and to add than to decide what you're going to stop doing. So I think it's like really fighting against the tide. The process that I described before, which I'm trying to get some alignment around in my organization, is just ask yourselves, just on a continuum, what is the highest and best use of our resources? We're a health insurance company, so you can just start there. Where are the fundamentals? Build out from there. Quality, member satisfaction, et cetera, et cetera, et cetera, so that we at least have an idea in our own heads if we needed to. Could we postpone some things because they're not really core to the mission or core to the future? Everything is valuable, but I don't think that it's easy. And, I think that you can see in many examples, whether it's state government or otherwise, layering of programs and regulations and great ideas, but nothing ever gets cleaned out of the back of the chute. And, it becomes very heavy at a certain point. So it takes a lot of vigilance.
So I'm going to ask one last question before we open it up to the floor. And that is, all of us are living in extremely challenging and uncertain times, and it's wearing on us as people. As leaders, it is a really difficult thing to think about how you can't run continually for 6, 8, 12 months. It's not possible. How did you personally cope with the uncertainty that you dealt with? How did you manage your life to make it possible?
Did or do?
Did, whatever.
Yeah,
Give
yeah.
me.
Yeah.
I'll start. I love the mission of my organization, and I really love the people that I work with. I believe in what we do. We have very close relationships with providers. I consider them to be friends, and that's what keeps me going because, there have been really hard times in the past. I mean, the country has gone through really, really hard times, and most of the people in the room weren't born, Vietnam War. I mean, there have been some really, really bad times in the country, much less in healthcare. COVID, unbelievable. Can you believe that we lived through COVID? We will live through things and we will figure out a way to make things better. I mean, I really believe that.
Go ahead.
A couple things. It's a hard question actually, because it does require thinking about what you did then when you were very focused on other things. I'm going to do a little of the professional advice. I had trusted people, Sherry at different times was one of them, who I could talk to, bounce things off of, trial it out, get advice. You need to have people you trust to help you make decisions. And I think there's always something we undervalue. That matters a ton. Second is you can't stare at the problem all the time. You just can't stare at it all the time. Look at if you are working and trying to figure out solutions, again, look to the past, look at different periods of history, look at different inspirational leaders. I mean, these days I try to cut my reading. So I find something like, Obama's speech at the Hamilton College, read the transcript, right? Try to find different things, looking back on the Revolutionary War and what some of the words were around that, because we're talking about democracy, trying to cut your staring at things with different types of inputs. And then just remember, like, for the most part, we are at a point in time when you look at that arc of history where things will change. We know they will change. They could change in 18 months. If there's a different Congress, they could change in less than 4 years. And every day that passes, as everybody knows historically, presidents lose some of their power. So I think there's lots of push and pull, but be a student of history at this time, because when you look back, you really do see examples of both how people got through adversity as well as what the possibilities are on the other side.
Go ahead.
So, actually, I mean, I agree with everything that has been said. I'm not working full-time now because I'm older than they are, as you may have noticed. And so I have been thinking a lot about what we can do, what I can do, and what all of us can do. And I've actually talked to groups of students before in various graduate schools, including this one in my past, and talked with students who aren't yet in leadership positions and sort of speculated with them about what you can do at your level, not being in charge. And believe me, you do not get your way all the time when you are in charge. So don't think that that is a given. But I think what is a given, especially right now when things are very bad, I think that everybody has to do something that they feel they can do. We don't all have to get arrested. We don't all have to put ourselves in harm's way. But I think if we're looking toward coming out of this with a better basic sort of framework, I think that politics is local and actions are local, and some reach the national level and some don't. But there are things that can be done by every single person in this room, and you know what they could be, or you could find someone who knows what they can be. I'm looking for those things for myself. I've done some of those things. I've spent the last 4 years working with a small group of people who are devoted to birth control access. Tiny, tiny organization, but we've done a lot and used the resources and talents and energies of young people. And to me, that is really fundamentally important. And it may not affect anything nationally at this moment, but it has the potential to do so. I think we have to focus both in our workplaces and outside as well for our own well-being, which is fundamental to being a leader, I think, on what we can do to improve our neighborhoods and our local communities. And again, I just want to suggest that people who work in jobs that who don't have graduate degrees, but who, and maybe not even higher education levels at all, are leaders in their own communities, and they know what they can do without being someone who's running an organization. So it's just to say that, I think we all need to focus on our own strengths and values and belief and do something positive and concrete.
I like do something positive and concrete. And with that, I'm going to open it up for
Oh,
questions.
good.
Okay, let me just take
Oh,
you
it's
in the back.
available to
Yes.
get
Thank you so much for sharing your amazing experience in public service. And my question to you is, as you had all mentioned, we learn from our successes and failures. So the question is your organization geared to measure this kind of stuff?
So how do you know whether you're a success or failure in what you're doing?
It's a good question. Well, one way to know is if you accomplish the goals that you set out for yourself to do. Goals are very big and lofty things, and you can't sort of do strategy around broad goals. But as you get to the objectives that sort of underline the goals, I don't want to be didactic here, you ultimately get down to projects that you can undertake in a reasonable period of time that make these goals more possible, and make us all feel better about getting them done. And those you can do, and those require measurement. And I would say if you're getting a grant to do something and it doesn't sustain itself when you're done, and it doesn't lead to measurable improvements, it should be stopped. I mean, we should not be running programs that don't work. We just shouldn't.
Okay, let me take another question. Yes.
Thank you. I'm Michael Myers, New York Civil Rights Coalition. My question is on COVID and your different institutions. Because some institutions, public and private, required their employees to get a COVID test, give a COVID vaccination. And so I want to know, did you lose employees because of the COVID vaccination requirement, or through disease that they caught COVID, or because they got scared of COVID and left the organization? And I just want to know from everybody.
Well, I'm going to answer first because it's a very
Yeah.
interesting question for me because as the Commissioner of Health and Human Services in the state, we had to make choices about that vaccination requirement. And I will just say the most interesting thing was, remember, COVID hits in March of 2020. The vaccine gets developed in the fall. We had that rollout where we had to pick and choose who got vaccinated first, if you remember all that. And obviously, healthcare workers were high on that list. But we had our hospital association come to us and say, you know what? We're having this problem, which is some of us are requiring vaccination for our workers, some of us are not, and workers are sifting themselves because of that. So they said, please require it of all of our workers. So we did, and it was painful, and we did a lot of work. We got sued, we won the lawsuits, and I think we would have actually been able to maintain that requirement, but for the fact that in DC things changed and we started losing court cases, and then the US CDC, and the federal government backed off of its federal healthcare rules. So we rolled it back. But that was a lot of work to create trust and agreement. The nursing homes were a lot more reluctant than the hospitals, and even to this date, the vaccination rates are low.
Okay, I have time for one more question, and I see a bunch of my students in the audience, so I'm expecting one of them to ask a question. Come on, don't be shy. Okay.
All right.
Okay. I just have a general question in terms of, as leaders, what were those moments where you were able to identify your ability to be a leader? I know like you never feel fully prepared or ready, but when were you sure that, yes, I have the ability, I have the skill set, I have the knowledge and competency to lead this organization towards its mission?
I'm afraid I didn't catch everything
So
you said.
when did you realize that you could be the leader, that you could do this?
I don't know actually if it's harder for women than it is for men to get that moment of inspiration that you can be a leader equally readily. But I'll still speak for myself. I guess I didn't think that I could be a leader, but I thought there were some things that were really important to do. And the more I talked to people, the more I was shocked to hear that they agreed with me. I mean, and the more simple I was, I mean, and it wasn't when I talked about technical things, people's eyes would glaze over. But when I talked about some fundamental things that I was trying to inject into my work life and principles that I was trying to enact, like how do you get a 6,000 person team? And how do you have people work together in teams? And how do you do really hard things with no money? The more I talked about those human problems in human terms and got this validation back, the more I realized that it was important. I thought it was important for me, but I didn't realize, I didn't see myself really as a change agent. And even now I feel that, I've been very fortunate to work in places with fabulous people. And it's not that I'm doing the work, they're doing the work. And they do the work, hospitals especially, 24 hours a day, 7 days a week. And I'm not there, even though I'm there at night that often. So it's part of what you're asking is maybe you can get there yourself. I think women do suffer from not being as readily able to do that. That's my personal belief. But I think the more you try to share what you're doing and why you're doing it, and people agree, and it looks like results in healthcare improve because you are doing something, or in your the little area that you run, the more you see that, I think the better you feel, which I think is, I know you didn't ask me how you feel good about it, but I'm answering that question anyway.
Pat? Did you wake up one morning and realize you were the leader?
I would say that everybody sort of comes to that feeling differently, and I think experience and going through, different times up and down helps. But for me, I think even in times of doubt, understanding that the people around you need you to be a leader, whether you feel totally self-confident in that, is very motivating. And I think great leaders come in many, many shapes, styles, colors, backgrounds. And people need to, the most important thing is to bring forward your genuine self into whatever leadership style you embrace. There's no sort of copying what you see as somebody that you admire. Sometimes I've done that in my career when I have felt insecure about something. I have channeled people that I admire to sort of pretend that I'm not me because I'm too insecure to deal with the situation. So, but at the end of the day, what has been most motivational to me is to realize that the people around you they really do need you to step up and to do the best that you can. And even if you don't feel it in that particular moment, it helps you get through it.
And I'll just say quickly, I would argue I was pulled in by the mission and the work, but I was pushed into the positions because I would never have said, I think I'm going to be good at this. I want to do this. But I would say one of the things that I'm pretty proud of myself for is recognizing when my leadership style no longer fits the moment. Like, I think I did a good job leading during the pandemic, but recognize that after it ended, my organization needed a different type of leader to really look at the long run, to be an institution builder, to really try to grow what we were doing. And that's part of the reason I stepped down. So I think leadership is bi-directional, both recognizing what you can do and what you can bring to the job and the work, and then also recognizing what the situation needs and finding that person. Because I found my successor because I wanted to make sure that the mission continued.
I have to say, you have to be, someone said it, you both said it, you have to be yourselves, and be able to talk to people about things that are important and seem bigger than sort of individual running your job. You have to know about your job really well, and you have to understand the context of healthcare and social services, and that's why you're in this program, understanding public service and what you need to do and what has been done. But you have to see that through your own individual lenses. And they don't all look the same, but they all share something. If you could just be yourself and authentic and communicate that to the people who work for you and who you work for.
If I could just add one more thing, everybody in the room is a leader. When you think about the way that you relate to your families, your communities, your friends, you can think of times when you really had leadership moments. And so I would urge you to embrace that and realize that everybody has that in them and that you exercise it every day.
That's a great note to end on. Thank you all very much